To the next in our Friday webinar series at the Center for Community Solutions. My name is Danny Carlson. I am the Communications Director and the Director of Digital Strategy at the Center for Community Solutions. And I'll sort of be a host for today, guiding you through our discussion. I really wanted to thank our panelists for being a part of today's webinar. Basically, the inspiration for this is next week, next Tuesday, in fact, will be the 100th anniversary of women getting the right to vote in the United States, which really kind of got me and also probably even more so our Executive Director, John Corlett, kind of thinking about, how has this current pandemic that we're in, how is that really affecting women and girls in the United States? And that was the inspiration for this. Next slide, Ebony. Just a little bit about us. The Center for Community Solutions, we're a nonpartisan nonprofit. We aim to improve health, social, and economic conditions through nonpartisan research, policy analysis, communications, and advocacy. For those of you who have been a part of our Friday webinar series before, welcome back. For those of you who haven't, welcome. We tend to do these pretty frequently throughout the year, either weekly or bi-weekly, and today is no exception. Ebony, can you, next slide, please? And I would like to introduce our panel today, many of whom need no introduction, but our first panelist will be State Senator Nickie Antonio. We'll be talking about the effect of elected officials, what they are and aren't doing in terms of COVID and women and girls. Then we will hear from Sarah Pariser. She is the Director of Grants and Programs from the Women's Fund of Central Ohio. And then Iris Harvey will be talking. She is the President and CEO of Planned Parenthood of Greater Ohio. As the presentations are going on, please submit your questions in the chat box. And at the end of the presentations, we will have a question and answer session with each of our panelists. So without further ado, Senator Antonio, I would like to toss it over to you.
Thanks so much. Thanks to you and Center for Community Solutions and John Corlett and the whole team for inviting me here today. I'm honored and happy, especially honored to be on the panel with my other wonderful colleagues. Overall, I want to start by saying that we're aware that COVID-19 has directly infected men a little bit more than at a slightly higher rate than women. The jury's still out on why that is. But I wanted to make sure we acknowledge that at the beginning of this. What I'm really going to talk about are some of the social effects and determinants of what exactly is happening right now for women and girls, especially through the lens of some legislation that we would love to see move in the Ohio legislature. But first, overall, the United States, compared with other nations, ranks 75th out of 193 for gender equity, just for gender equity. So right off the bat, we're a little bit behind, quite a bit behind. COVID-19 has underscored society's reliance on women, both on the front line and at home, while simultaneously exposing all those structure inequalities that cross every sphere, from health to the economy, security, social protections. In times of crisis, when resources are strained and the institutional capacity is limited, women and girls often, and right now, are facing disproportionate impacts with far-reaching consequences that are only further amplified in the context of fragility, conflict, and emergencies. It's a very, very fragile structure that connects everything together. And those hard-fought gains for women's rights, 100 years since some of us got the right to vote. Women were on the list, but it took a long time to enfranchise all women, especially Black and brown women, to be included with white women in that right to vote. And we never need to forget that. We should always remember that. And as we see, COVID-19 is exacerbating the issues that have existed long before the pandemic: racial injustice, crimes of violence against women, sexual exploitation and trafficking of women and girls, and women's existing economic inequalities. Women and girls are especially vulnerable. Now, I'll start with human trafficking. Along with many social consequences of the virus, young people are spending more and more time than ever at home on their phones. And for those parents out there, you know, absolutely this is true. But apparently, this has made them more vulnerable to human traffickers who are lurking on social media. The reports of law enforcement is just devastating on this aspect. The reporting numbers bear this out. In April of 2019, for example, there were 287 reports in San Diego County, California. This April, the number shot up to more than 850 reports from the DA's data. So that shows us there's something going on here, very troubling. Our local numbers mirror the trend that's happening across the country. Closer to home, this trend is also frightening. There are 244 missing juveniles in Cuyahoga County today. We have no idea how many of these children might be the victims of traffickers, but that's a very frighteningly high number. Violence against women is especially necessary to point out that the essential and informational workers such as doctors, nurses, street vendors, all the folks that are on the front lines working and essential, they're at heightened risk of violence as they're navigating deserted urban or rural public spaces, especially if they're trying to use public transportation to get to and from their jobs, especially at off hours. You know, one of the things that's a safety precaution is just functioning and moving through when there's a crowd. But if the crowds are depleted as they are right now, it really creates some situations that are very unsafe and risky for women and young girls. The economic impacts are also likely to increase sexual exploitation and child marriage, leaving women and girls in these fragile economies with few or no options. And those who are in refugee contexts, it's especially dangerous time for them. Now, child abuse, which is something that many of us have been paying attention to, and it's very disturbing. Child abuse reporting is down. We do not believe it's because child abuse is down, but because this consequence of mass school closures amid the coronavirus pandemic, there's a big drop in the reports of child abuse. It worries me as much as child welfare advocates. It's the lack of interaction with mandatory reporters for violence and abuse in schools and educational settings is definitely to blame. In the first week of school closures, just as an example, in San Diego County, the number of reports to child abuse hotline went from 1,730 to 728. That was a nearly 60% decline. These numbers mirror those nationwide, but they don't mean that child abuse, as I said before, is decreasing. Domestic violence is another concern of ours, mostly affects women and young girls. According to Human Rights Watch, the crisis, especially in lockdowns, triggers a greater incidence of domestic violence, and we can understand why that would be. Increased stress, cramped living conditions, breakdowns in community support systems. Additionally, crisis can further limit a woman's ability to escape an abusive situation and to see their abusers held accountable. We're seeing all over the world domestic violence cases have increased during this COVID crisis, including in our own community. At the Domestic Violence and Children Advocacy Center in Cuyahoga County, calls to their hotline have increased by 40%. And we must remember that more than 1 in 3 women in the United States will experience physical violence by an intimate partner in her lifetime. We're likely to see this number increase for 2020. Now, ordinarily, the legislature would be on summer break right now, but between the COVID pandemic and alleged major GOP money laundering scandal, things have definitely stalled in the legislature, in the legislative work that's going on. Our offices continue to work with constituents every day, and we can continue to help connect the dots for folks with state government. But the legislative work, which is a huge frustration for me, has really stalled. One of the bills that I've been working on in the domestic violence realm is this, it is Senate Bill 146, which would classify strangulation as a felony, because currently it's a misdemeanor. We've had 3 hearings. 47 other states have done this, have moved to this place. We really think that it's possible to really have an impact on the law by doing this, because by moving this legislation, according to the Strangulation Training Institute, women who have been strangled by their partners are 750% more likely to be murdered than domestic violence victims who have not experienced strangulation. This is an incredible statistic, and one that this is legislation we definitely need to move. But right now, not much is happening, but we hope we will get it done before the end of the year. The good news on the DV front is that during the budget this past year, we were able to put into the budget funding for a budget line item of their own for general revenue funds, $2 million in the 2-year biennium. That was a big plus. It was brand new. It was great. And we're real excited about that. And we hope to add funds to that during the next budget cycle. The last thing I'll talk about is the economic consequences. We have a bill right now, Senate Bill 297 with Senator Craig, that would put a moratorium on evictions and foreclosures. It's incredibly important. Women are affected much more when it comes to evictions, and sadly, Black female renters are twice as likely to be evicted than white renters. And so we know that if you don't have a home, it's pretty tough to take care of your family, to do anything else, and the economic consequences are just going to be devastating. And so I want to get back to work to make sure that we can pass some of this legislation. I'm looking forward to hearing from my other colleagues. Obviously, I could go on and on, but I will stop and pass it over to Sarah Pariser, who is the Women's Fund of Central Ohio Director. Thank you.
Thank you so much, Senator Antonio. At the Women's Fund, we know that we need to get more women in elected office because they make critical policy decisions that uplift all women, and your work definitely highlights that. So thank you so much. I'm Sarah Pariser, Director of Grants and Programs for the Women's Fund of Central Ohio, and it is such an honor to be included in this conversation and with such brilliant leaders across our state. And thank you, echoing Senator Antonio's thanks to the Center for Community Solutions for your work, but also for ensuring that we're highlighting the impact of COVID-19 on women and girls. And so at the Women's Fund, we've spent the last 20 years honing this application of applying a gender and a racial lens to our work. And we know that it's critical that we continue to apply not just the gender lens, but the racial lens to really understanding the impact of COVID-19 on women and girls. So I'm going to quickly share a little context for where we were in the sense of our work prior to COVID-19, the impact of COVID-19 across women and girls across Ohio, and then dive into some strategies for ensuring that we do continue to apply that intersectional lens to philanthropic support and responses to this crisis. So at the Women's Fund, we are fiercely committed to igniting social change for the sake of gender equity. And we do this by sparking conversation, connecting people and organizations, and influencing opportunities for economic empowerment and leadership for women and girls across Central Ohio, where we focus, but truly across the state. And we do that through the pillars of our work: grant making, advocacy, research, partnerships, and community education to create that lasting social change. So, in the philanthropic sector, we have long responded to gaps. And right now we have an opportunity to not only help our communities through this crisis, but also to make sure that they're stronger in the future. And, I'll say this probably about 20 more times at least over the course of this conversation, but it is critical that we ensure that gender and race remain a central focus in our analysis of this crisis, but also in our responses and in our decision making. So, prior to this day and kind of where we are right now, we know that from the lens of our work in terms of economic empowerment and leadership for women and girls, there are some really key factors influencing that landscape. The earnings gap is really important for us to understand, as well as the gender and racial wealth gap, and really how we're seeing women responding to this crisis truly on the front lines, upholding our families and our economy, but also how they've been impacted. If you would, next slide. I wanted to start off by sharing some of the recent data, really understanding why it's critical to not just apply a gender lens, but also a gender and a racial lens to really look intersectionally about how these issues impact women differently. When we're looking at the wage gap, which is a really important indicator of where women stand, economically, kind of week to week, month to month, being able to support their families, oftentimes we hear about, these numbers. And maybe we hear about, all women in the wage gap, but it was really when we unpack that intersectional approach. So, looking at the racial and ethnic disparities, what we can see is that women of color are earning far less. Overall, with these median annual earnings for full-time year-round workers, but also when we're looking at job to job. Next slide, please. And so at the Women's Fund, I mentioned that research is a pillar of our work because we know we have to provide the numbers and the stories to make sure that we're advocating for this lasting change. And so for us, we really wanted to go beyond looking at the wage gap, but to understand wealth. And wealth means how much money do you have in your savings account? Are you able to put tires on the car if you get a flat? Are you able to take a sick day? Are you able to pay for the doctor? Really, really important things, not just talking about, I think wealth, oftentimes we think that it can be inaccessible, but we all have wealth. It's just varying degrees of what we own. And so, when we look at that holistically wealth, what we find is that all single women own 40 cents to the dollar. Latinas own 8 cents to the dollar. And Black women own 2 cents to every dollar. And no matter, how long I've looked at this data, it still hits me. And I think it's really important that we know that this is where we were before COVID-19 hit. So women, and particularly women of color, were not prepared financially to weather an economic crisis. And what contributes to that wealth gap is much broader than just earnings, right? What we found doing this research is that health can influence wealth. The cost of healthcare and crises were one of the biggest drivers for women being able to be, economically secure. Home ownership, caregiving, education, and all of these factors are exacerbated by the current crisis. So even before we got to where we are, which I'll get to next, what we knew is that looking in Ohio, 15% of women live in poverty compared to 11% of men. That's pretty significant. That's almost 50% more. And yet, when we look at the households that had single women breadwinners with at least one child under 18, over 45% of them were living below the poverty line, which is astounding. And we have to do something about it. And then when we again apply that intersectional lens, women of color are far more likely to live in poverty than white women in our state. And yet what we know is that, yes, in Ohio, women are on the front lines of COVID-19, right? We are on the front lines in terms of caregiving, working in those industries that are responsive at grocery stores, at drugstores, in healthcare, and providing those really critical services in terms of childcare and social support. I mean, those statistics, those percentages are pretty remarkable. There's a proverb that women hold up half the sky, but I would say when looking at this, women are holding up far more than half the sky when we're looking at this COVID-19 crisis and the responsiveness. And yet, you know, we're not just looking at this in terms of a health crisis, but we're looking at this in terms of an economic crisis. And historically, with an economic downturn, it tends to be men more than women who are impacted. Yet this is the first time that we've seen in our lives that it is women more than men who are being impacted financially as well. And so, you know, yes, we must be swift in terms of our responsiveness, but we also have to be applying that gender and racial lens, because paid leave, childcare, flexible work schedules, that's all critical. You know, even before this crisis, more than 2/3 of all minimum wage workers were women, yet women were graduating college in higher rates than men. So we have to be really understanding all of these complex factors. And next slide, please. So that's what we're doing in terms of on the front lines in Ohio, and yet across the nation, you know, it is these industries that also have been most hit, where women often are the majority of workers, right? The percentage of workers who have access to those really critical policies. And there's so much, it's hard for me to stop because I could talk for hours about just the, you know, these impacts, but, you know, as I said, for the first time, it's women who are hit economically more so than men. So, you know, just before the recession, it was the first time that women actually were just over 50% of the workforce. And also they were at a much lower rate in terms of the percentage of the unemployment claims. And yet in April, over 55% of the job losses were those held by women. And just this week, there was some research that came out that really was looking at, you know, the impact of COVID-19 and what we will see. And what people are saying is that looking at the data in terms of especially childcare and paid leave and how that's impacting women more so than men, even in a household that, you know, a heterosexual 2-parent household where there might be, you know, a man and a woman, it is the woman who oftentimes is the one who's carrying the burden of that unpaid labor, of the childcare. And with the majority of childcare centers, you know, not being able to open or open at full capacity, with many schools moving to virtual. And yet we know that virtual school does not mean, you know, no parent support needed. If anything, it's more to help students navigate that. It is women who are the first to be making those really hard decisions that if someone has to leave work, who's it going to be? And if we know that women make less money than men, it's kind of a no-brainer. And so unfortunately, you know, this report that came out was finding that over 1/3 of millennial mothers who are unemployed said that it was because of a lack of access to childcare because of this crisis. And yet it was only about 1 in 10 fathers. And so, you know, that alone is just going to set us up for decades of you know, recession, not just economically, but also in terms of those hard fought gains. So next slide, please. You know, and so we all have roles to play, and what role does philanthropy have to play in that? And so, you know, philanthropy has a long-standing history of filling those gaps where, you know, Senator Antonio is fighting for the policy, and, you know, Iris is going to be sharing about the work she does, and we all have to work together. And yet in this in-between, it is philanthropy who really needs to step up and fill those gaps. And there has been an incredible response in terms of COVID-19 responsiveness and funding. And yet, unfortunately, with that speed, many funders are not applying a gender or racial lens to their responses. They're getting dollars out critically, which is so important. But here at the Women's Fund, we know from this data, from the current landscape, we have to be asking those questions. How are women of color, how are people of color being impacted differently? And then applying those unique approaches. And so I'll share just briefly, you know, some core strategies that we are really asking the philanthropic community across our state, but, you know, hopefully across the nation to be thinking about. And then I'll share a little bit more about what we've done, you know, locally in terms of our responsiveness and where there's some hope and some stories within that. And so next slide, please. So the core strategies that are really critical for applying that gender and racial lens to the philanthropic responsiveness, but quite frankly, I would say to anyone's work, if we're applying an intersectional lens and really listening to learn how the people who are impacted most, what they need, are asking, are the people who are impacted by any issue, are they at the table? Are their voices shaping the solutions that are needed, and how we can bridge those gaps, right? And ensuring that women and women of color specifically are involved at all levels of planning across those response strategies. Looking at leadership, looking at representation, just really asking those critical questions. And, you know, at the Women's Fund, that's what we have done. So if anyone's interested in any of this, please feel free to reach out to me. My contact information is on our website. I'd be happy to share these slides, these resources. If anyone is in the space of thinking about applying an intersectional lens to your responsiveness, the Women's Fund is here to help you. Next slide, please. And I did want to share just a few stories of when we apply all of those strategies, what's possible. So, you know, at the Women's Fund, we stepped up really quickly. We saw the impact, we were asking these questions, and we were able to launch an immediate impact grants approach that got micro investments into grassroots organizations in the communities that were focused on women and girls of color. So nationally, about 0.6%, right? Less than 1% of philanthropic dollars go directly to women and girls of color. Not enough. At the Women's Fund, we are fighting to make sure that that changes. We are leading locally, and we hope to inspire that to change across the state. So with this immediate impact grants making program, we focus on grassroots, we focus on micro investments, and we focus on speed, really listening to the community with what they needed, while employing a participatory grant making model that really put community members front and center at making the decisions of what we needed to fund. And so, you know, what that looks like, it might be, we know that women have to vote. We've got to get out there, especially communities, New American communities who might not have access to resources. So what could we be doing to ensure that if there were, you know, food and supplies that were being delivered, maybe there were some resources, some informational packets included in that. You know, so many women are participating in programs to support them thriving economically, but they might only have one laptop or tablet in the house, and that's got to go first to their children for school. So how could we be supportive with our partners who really might need it, you know, to provide Wi-Fi, hotspots, tablets, so that women too could have opportunities, and so on and so forth. And so, you know, really excited today, we announced those partners. So they're all on our website. We were able to invest in 19 programs. The need that we saw was unprecedented. We've never had so many applications, which we know means that the need is even far greater than just what we're seeing in terms of this surface. You know, really excited with these amazing programs, the majority of which are laser focused on women and girls of color. To say that it's across that broad spectrum, and there's so much, I think, hope and opportunity because the resourcefulness, the responsiveness of these organizations who are truly stepping up and stepping in to serve their communities. I know that we will get through this stronger than where we started, but it will require all of us working together to being bold with our investments and to applying, you know, a really critical gender and racial lens. And so with that, I'm just honored to pass the virtual baton to a colleague that I respect so immensely, one of our longtime partners, Iris Harvey with Planned Parenthood of Greater Ohio.
Thank you, Sarah. Good afternoon. Thank you, Center for Community Solutions, to John and Danny and Ebony. It's a pleasure to be here, and I welcome all of our guests. I see we have 113 participants. This is wonderful. So Planned Parenthood was founded 104 years ago on a very revolutionary idea that women deserved access to both information and health care that let them make decisions about their lives without limit and without others making the decision for them. And we're very proud to be a major provider of both reproductive health care as well as sexual education. We operate in areas that are medically underserved. Our patients usually have little or few other healthcare providers and access to healthcare. And most importantly, 2/3 of our patients live at or below the federal poverty line. And so to a large extent, this coronavirus is having an impact on our patients as it is on the whole community here in America and across the country. But the coronavirus is laying bare structural deficiencies in American society, from employment and living wages that don't exist. Sarah and the Senator Antonio both talked about it. Our employment structures where we've outsourced manufacturing, where we have low paid jobs, and where healthcare is tied to employment. These all impact women and their health. The healthcare system is largely failing a lot of our citizens. The New York Times said in an opinion that it takes from the poor and working class to generate wealth to the already wealthy. And we know that racism in this country has never been reckoned with. And now with COVID, it's sort of ripped the veneer off of the way we see our society. Over the last decade, we've talked a lot about the social determinants of health. And today we are now speaking about racism as a public health issue. Whichever area of our society we look at, we just can't consider COVID as a disease that has reached the level of a global pandemic. America will not be the same from COVID from this period going forward, is my opinion. So women, and particularly women of color, are bearing a very heavy toll on this disease. And of course, where women are considered, our reproductive health care will always figure largely. But today I want to speak about how COVID and has invaded an infrastructure that is weak and is enabling our systems to not serve people, to not serve women, to not serve girls. And so I'd like to walk us through that infrastructure, some of which Sarah and Nickie Antonio have talked about, but I think we need to look at that in terms of how we also look at the decisions that women are fearing and are making for reproductive health care. So I'll start with that COVID. We know that this is complicated. Next slide, please. And if I think about it, sort of a formula here: COVID plus unemployment plus persistent poverty plus racial inequality minus access to health care equal really what we consider a formula for disaster. Next slide, please. So we've talked about this, in May and June at the height of the coronavirus, we saw 1.2 million Ohioans filing for unemployment claims. And we know that the conversation that's going on now is economically about how do we get people back to work? How do we get them unemployed? But we know that who's been hurt by this the most are young women and women of color who've been the hardest hit because they're in the jobs that have disappeared, maybe permanently, but certainly have closed down very, very quickly now. Next slide, please. So, the message we've been struggling with in the last month, and it's very close to home, is whether or not we send our children back to schools. So is the rush to send our kids back to school so they can get a good education, or is it because we need mothers to get back on the job? And Sarah touched on this a bit in her area, but women are increasingly major breadwinners in our country. And our society is not really addressing that. Can we have the next slide, please? The share of breadwinning or co-breadwinning mothers has doubled since 1967. And in Ohio, 68.6% of all mothers are breadwinners or co-breadwinners. So we know that most children grow up in the U.S. Raised in households where everybody works one way or another. They may not have a great job, but they are working to make ends meet. They're most likely to be raised maybe by a single parent or two married parents, both of whom are working. And only a minority of children grow up in families with a full-time stay-at-home parent. So although working parents are sort of the modern family unit that we have, our systems have not kept up with them. And so we rarely have a social system that supports caregivers and that has policymakers that are putting our economic assets into it. So the biggest COVID-related controversy today is whether or not to open our schools, right? And a major driving factor is whether our children can get the education, but also whether parents and their mothers can get back to their home. And this should not be a consideration that we take lightly. And we know that mothers will bear the burden. When something happens in the family, whether it's an illness, whether it's an economic, it is a mother, it's a sister, it's a daughter who usually is the one who's taking care of this. And as you can see, this is a growing trend, and it also has implications in relationship to not only gender, but also race. Can I have the next slide, please? So mothers in low-income families are more likely than higher income mothers to be counterpart to breadwinners. And so you can look at the lowest income quintile in our society are the women who are more likely to be the key breadwinner or also a co-breadwinner. And you look at the top income quintile, you have less women participating as the major breadwinner. So again, women are on the front line, they're losing their jobs, and yet they are the ones with the least income coming in, the more dependent on it, and are being hurt the most by this COVID disease and the unemployment that we're facing. Next slide, please. But we also know that Black mothers are more likely than any other racial or ethnic group to also be breadwinners. So again, we see the impact of unemployment, the impact of COVID having an effect on our women, our mothers, and our women of color. And they are there every day struggling to make ends meet, struggling to healthy, and they are bearing the burden of COVID, not only from a disease standpoint, but also from the economic standpoint of being breadwinners who have lost their jobs. Next slide, please. So unemployment also equals uninsured. And here's where healthcare really takes a dive and where we have to be thinking about how are we going to recover from COVID and create a different system. Next slide, please. So we know that nearly half of females prior to COVID had insurance that was insured through the plans that was through their employer insurance plan. So as your job goes away, so is the risk of your insurance going away. So post-COVID, women accounted for 56 of the job losses. They are overrepresented in the hardest hit jobs. They have a higher unemployment rate than men at 13.9 versus 11.6%. And Black women unemployment is 16.5 and post-COVID. Latinx are 19.0 and young women 20 to 24 years old have an unemployment rate in this COVID time of 24%. Next slide, please. So we've got a slippery slope here, unemployed and uninsured. What are women going to do as they come out of this COVID disaster if they have no insurance? The questions that we as a society need to address are how are we going to support people in a way that they can have access to good health care, that they can have good wages, and that they can take care of their families. Without these areas being addressed, then just defeating the disease itself is not a worthy goal. Next slide, please. So prior to COVID, we had 1.5 million Ohioans already living in poverty with 3.5 million nearly poor. So this disease has come. Hello?
Oh, I'm sorry.
That's all right, has come into our society and into our state where our women and our families are already struggling with poverty. The overall poverty rate was 14%, and the extreme poverty rate was 10%. And race matters. 28% of African Americans and 26% of Latinx were in poverty compared with 10.7% of whites. 15% of households experience food insecurity. More than half, 56% of residents earning less than $20,000 a year spend more than half of their income on rent. And low-wage jobs stood at 25%, with many held by women in Ohio. And working families who live at 200% of the poverty line were 31% of our population. These are the patients that we serve at Planned Parenthood. Next slide, please. So what is the impact when we look at COVID? What is the impact on sexual and reproductive health? So there's been a great deal of research that's looking at and asking women, how are you adjusting to coronavirus? What decisions are you making about your sexual and reproductive health? And here are some of the findings I'd like to share with you. Next slide, please. So COVID-related policies have changed how sexual and reproductive health care is accessed. It's also affected the choices and decisions that people are making about childbearing preferences, contraceptive uses, access to contraceptive and other sexual and reproductive health services, and as Nickie talked about earlier today, the exposure to intimate partner violence. Let's look at some of the numbers here. Oops, sorry. So people want to delay childbearing or have fewer children. A study by the Guttmacher Institution that was national and looked at over 2,000 women found that many women report that their fertility preferences have shifted in response to COVID-19. Of them, a third are saying that they want to delay childbearing or have fewer children. And then again, race matters. So you can see for non-Hispanic white women, 28% have this fear and this concern. But for Black women, it's 44%, and Hispanic women, it's 48%. You can see, again, when we also look at gender identity, that there's a difference between straight and LGBTQ people as well. 46% saying they are delaying childbearing or plan to have fewer children. And again, by income, there's a difference, but actually not that big of a difference when you look at whether they're at or below the federal poverty line. Next slide, please. People who experience delays and cancellation of their sexual and reproductive health care and contraception are also expressing concerns. They are saying, and we know this, if I look at our own center, because only non-essential care was under question, the ability to see people who had a need that could be delayed meant they could not come into a health clinic. And so what we're seeing is, and many places were closed down, that women experienced a great deal of delays. We actually did see as much as a third of patients who we had to serve either remotely through telehealth, or who for some reason or another were afraid to leave their home and to come. So again, by race, you see the difference. For white women, it was 29% who had cancellations or delays. For Black women, 38%, and for Hispanic women, it was 45%. And again, depending on your gender identity, for queer people, it was 46%. And income is not quite as mixed. Next slide, please. Also, the number of women who were interested and had concerns about being able to get care, you can see that almost a third of women had a concern that they were reporting that they may not be able to get care. And again, you can see the difference by race as it increases. And I think if we look at Hispanic women, of course, these would also include immigrants and not people who just had to be legal residents of the country. And you can see that that area increases substantially. Next slide, please. And because of COVID, many women are thinking that they are not going to be able to afford or obtain contraceptives. And again, the numbers are frightening when you think of that 27% of women who are coming out of this COVID who have lost their insurance, and we don't know how they will be able to apply and be part of the social systems like Medicaid, that they may not have access to reproductive health care, which means unintended pregnancies, which puts women at greater risk for economic insecurity and health risks as well. So next slide, please. So post-COVID, what can we do to support female identifying people in terms of making sure that the infrastructure that we provide in society helps women to have healthy lives? We need to address the gender wage gap. We need to support comprehensive paid family and medical leave. We need to increase access to paid short-term leave. We need to improve access to affordable, quality childcare. We need to guarantee access to quality healthcare, including abortion, increase access to affordable housing, protect workers against all forms of gender-based violence, protect the rights of incarcerated people, promote progressive political leadership, and let's not forget, caregiving responsibilities have increased during the corona pandemic. Increasing caregiving could have long-term effects on the earnings and employment of female identifying persons. Reproductive health is not just a system within our body. Reproductive health requires that a woman and her family have the full protection of our society and can live a meaningful, healthy, and secure life. And we hope that this meeting today and the conversations that we have around this will start us thinking about the society that we want to create post-coronavirus. Thank you.
Thank you so much, Iris, and thank you to Sarah and to Senator Antonio as well. First, I do want to direct people to the chat box. We have been getting some questions in, and some of those have been answered kindly by our panelists. But as we're all listening to the presentations, it seems like in terms of COVID, there's a difference between being infected and a difference between being infected and affected. And it seems that women are definitely being disproportionately affected, as we're talking about lack of economic security, wage gap, fears. What do each of our panelists, and we'll start with Senator Antonio, what do you fear will happen to the progress that has been made in terms of women getting that equality and getting progress to be equal to their male counterparts?
Yeah, it's a real concern. I mean, I think we started out this conversation with COVID has shed a light, has put the magnifying glass and exacerbated every ill that was already existing, every problem, every issue. And so certainly women's equality at the top of the list. In the state of Ohio, we've been fighting, especially in the legislature, for reproductive freedom and rights the entire time I've been there, for sure, and continue to have this battle that's been waged. I'm fear that we will lose ground for sure in that front, just because of the isolation right now. And so many of the things that we've talked about really affect women, as far as if you're moving up, no matter where in position, whether it's just getting finished with school, whether it's putting a little money in the bank, savings have been totally depleted because if you had a little bit of a safety net, it's gone. I have a 30+ year old daughter. We have two. They've both experienced being unemployed right now. Their saving grace is that they don't have any debt when it comes to school debt, you know, any kind of debt from going through college, not so much for so many of our other younger people. So younger women are going to be behind because of this. I mean, in every aspect that you can think of. We had just been having the conversations in the legislature around pay equity, around providing those benefits for working families to have paid leave. All of that has been moved off and into the back burner. Part of the conversations, the movement that we were having, LGBT equality, we had momentum going. Now suddenly, everything's been moved to the side, and now we're in this crisis mentality. And usually when that happens, the issues of those of us who are underrepresented and underappreciated, frankly, get moved to the back as well. And so on every one of those levels, I have a great concern that women will and girls will lose ground. Absolutely.
I would agree with you that all of the conditions are in place for women to lose ground. I'm hopeful that since we are also experiencing this pandemic at a time when we're also experiencing social unrest and young people, not just young people, but young people demanding that we hear their needs. I heard a young woman in Chicago say the other day after there was the unrest and looting, and she made a comment that I thought was extremely profound. She said, "You have looted my future," right? And so what is the big deal if I loot your Nike or your Apple? And while we don't necessarily want to condone that type of protest, we know that it's because of anger, and we know that this social change has actually an opportunity for us to make a difference. And I'm hoping that both our civil society working together along with our elected officials, that we can push this. And I think industry, we have to put public health in every part of our society. We can't let industry off the hook. We need to make sure that they are taking a public health view to this, and that we're changing the way we operate, the way we value people, and the way we give people the valuable tools that they need to live a healthy life.
Yeah, you know, I agree with both of those perspectives. And I think, you know, as we know what we need to do, we know what the solutions are. And, you know, in terms of the gender and racial wealth gap, which COVID-19 has exacerbated, the Women's Fund did research. We know what are the programs, what are the policies that we have to be investing in, and all of that research and those solutions on our website, free for download, because we want everyone to have access to that information. You know, but it also will require bold investments. You know, I shared where there's opportunity because of what we've been able to fund, but that was only about 1/3 of the requests, which means that we were not able to fund 2/3 of those requests. And that's just in Central Ohio. That is in 7 counties. And we are, you know, one of just a few funders and the largest funder in our state focused on women and girls. And we need more. But I do think that there's an opportunity. We've seen, you know, looking back through history, it is, you know, Iris, thank you for saying that, it is in these periods of unrest and disruption where we can choose a different course. So, you know, thank you for, you know, Senator Antonio and Iris for the work that you're doing to lead the way. And, you know, to the Center of Community Solutions and your staff. I really think that we can move forward in a different direction, but we have to change. We have to be bold, we have to be brave, and we have to be transparent.
And, you know, I think that going off of what both of you have just said, you know, I've been thinking the whole time, starting with when Iris was talking and now with you, Sarah. There was a wonderful, wonderful lesbian philosopher, Audre Lorde, who said the master's house will not be torn down with the master's tools. And so I think we're in that moment. And my cup is always half full. So while I sounded a little bit like Debbie Downer with a lot of the policy stuff, there are incredible women leaders. Ohio has some amazing ones. We have a minority leader, Amelia Sykes, young woman who's really, you know, just showing incredible leadership. We're looking at some national leadership right now. And every young woman, I saw that video that you're talking about, Iris. I just saw it this morning. Every young woman that stands up and says, no, you're not going to do this anymore. This is my life. And I'm going to move forward and I'm going to tell you how we're going to do it. I am very, very hopeful. While it is a time of, you know, great challenge, I'm very hopeful about how we move forward, but I do also believe the consensus from all of us is, I think we're going to have to figure out different ways to do it.
Yes.
And I think it's going to take a multi-generational and certainly a multicultural approach to how we do that, because, and I hope I don't offend anybody, but I'm sorry, you know, the old white man's way of doing it up to this point is not working for us.
Right.
And it's time. It's definitely time. I am very, very encouraged and, you know, excited about how we can take this moment that is so challenging, but create opportunity out of it.
Yeah. And I think just to add to that, we are at an important moment in that we have in many ways across so many sectors sort of emptied out our bank account, right? When we talk about needing to spend out of our rainy day fund over the next few years. So what that means is that we, the people, need to make sure that the elected and others understand how we want that money spent, not the same way, not to the same people, and not for the same things. We need to shift our value system, and we do that in many ways. We do it at the polls, right? And I think that's the change. We do it at the polls and we do it at the street, and both of those are happening now. Yeah. So I'm actually very encouraged that we can do things. We have to make our minds focus that this is the time. Oh, we can't hear Danny.
As so often, unfortunately, happens with these webinars, we have a lot more questions than we have time for. So it is 2 o'clock. We do want to be respectful of everyone's time and schedule. But just a couple of things I did want to mention before we let you go. The slides and a recording of this webinar will be available immediately after today on our website. You can find it at COMSOLS, COMMSOLS.com/webinar women COVID, and that should be available immediately following this. And I also do want to point out that in 2 weeks we will have another webinar talking about the LGBTQ community and what effects COVID is having on that community. So again, I wanted to thank our panelists so much for taking the time and the effort to prepare such wonderful and informative presentations here. There were so many questions I wanted to get to, but I felt like it wasn't fair at 1:59 to ask some of them. So thank you all again, and thank you everyone who attended today's webinar. And I hope that we will see you all in 2 weeks on August 28th at 1 o'clock. Thank you so much and have a great weekend, everyone.
You too. Bye, everyone.